Hi, this is Dr. Hua Cao. I'm going to do a series of talk on Chinese medicine dermatology. I have taught Chinese medicine dermatology at Southern School of Natural Therapies in Melbourne from year 2007 to 2015. What I found with the Australian graduates is that they lack support after leaving school. In China, the graduates go on to work at hospitals under the supervision of senior doctors, even professors. In Melbourne, the graduates normally go to the community straight away and become the private practitioners. When they have questions, they normally have to do a lot of self-study, either from books or internet. This made me want to record some of my teaching sessions to make it easier for them, for those new practitioners, to refresh their knowledge. Now, about myself, I was a medical doctor in China and did a PhD in psychiatry at the Flinders University of South Australia. Other than the Chinese medicine that I have learned in China, I formerly studied Chinese medicine at RMIT University in Melbourne, which is a joint degree with Nanjing University of Chinese Medicine. I've been practicing Chinese medicine since year 2000. What I plan to do is to start with some basic knowledge of Western medicine dermatology. Then from the second session, we shall go into the dermatology of Chinese medicine. Now let's look at some of the slides. Now let's quickly go through the common skin lesions to make it easier to go to the Chinese medicine part. The first one is macule, Chinese called ban. Macules is a small circular flat spot less than 1 centimeter in diameter. If it is bigger than 1 centimeter in diameter, it is called a patch. The second one is vesicule, Chinese called a pao. A pao is a raised lesion less than 5 millimeter across and filled with a clear liquid. If vesicles are more than 5 millimeter across, they are called bully or blister. Pustule, which we call nongpao or nongbao, is a raised lesion filled with pus. Now let's have a look. This is vesicule. In the middle, there are water, and the small, the bigger ones called blister. Macules, they are ban, and the pustule, they filled with pus. Papules or plaque is a solid and raised lesion which is less than 1 centimeter across. A patch of closely grouped papules and more than 1 centimeter across are called a plaque. Papules and the plaques can be rough in texture and red, pink, or brown in color. Nodules is a solid lesion that has distinct edges and that is usually more deeply rooted than a papule, such as a lymph node. A nodule more than 2 centimeters in diameter is called a tumor, like fibromas and some types of lymphoma. Here are some pictures. Now, wheal, we call 风团 in Chinese. It is a skin elevation caused by swelling that can be itchy and usually disappear soon after erupting. Wheals are generally associated with an allergic reaction, such as to a drug or an insect bite. telangiectasia, Chinese called 毛细血管扩张, is a small dilated blood vessels that appear close to the skin surface of the skin. Telangiectasia. Now, ulcer is a lesion that involves loss of upper portion of the skin, epidermis, and a part of the lower portion, dermis. So it's loss of epidermis and part of the dermis. An ulcer that appears as a deep crack that extends to the dermis is called a fissure. Scale is a dry, honey built-up of dead skin cells that often flakes off the surface of the skin. Here are some pictures of ulcer and scale. Crust is a dried collection of blood, serum, or pus, also called a scab. A crust is often part of the normal healing process of many infectious lesions. Erosion, Chinese called 糜烂. It is a lesion that involves loss of epidermis. Excoriation is a hollow crusted area caused by scratching or picking at a primary lesion. Here are some pictures about crust, erosion, and excoriation. Scar is fibrous tissue that have permanently replaced normal skin after destruction of the dermis. A very thick and raised scar is called keloid. Lichenification is rough, thick epidermis with exaggerated skin lines. This is often a characteristic of scratch dermatitis and atopic dermatitis. Atrophy is an area of skin that has become very thin, wrinkled, normally seen in old individuals and the people who are usually very strong, who are using very strong topical cortisone steroid medication. Here are some photos about it. And here a summary of a picture of different kind of skin lesions. I think it's very simple to most of the people, so I won't put a lot of time for this part. We have quickly gone through some very basic knowledges about skin. From next time, we'll start Chinese medicine dermatology. See you next time.